Hello, everyone. Thanks for joining IAD as I welcome our new carrier partner, Medigold. And we're going to learn a little bit today about their Medicare Advantage plans. We're really going to be focusing on Ohio, but they are also available in Iowa and Idaho. My name is Christy Strauss, and I'm a broker sales manager at IAD. And those of you who are new to us, and those of you who aren't probably understand we are a full service FMO with a national footprint. One of our unique services at IAD is that we provide the opportunity to bring your business and select a level of services that you would want. And some examples of that are things like leads and marketing co-ops, back office support, bonus dollars, and more. So I encourage you to give us a call at 800-381-0977 or go to our website at www.iadbrokerage.com. This is one of our first virtual sales summits, and this will be recorded and housed in our YouTube video library. We'll also have it available on our social media platforms and eventually on our website. So without further ado, I would like to introduce to you Eric Bowman with Medigold. So Eric, go ahead and move it from here.
Okay, thank you so much, Chris. I appreciate the introduction. Good afternoon. My name is Eric Bowman. I am the manager of broker relations here at Medigold. So basically, my title is anything broker related. Medigold is new to the broker world the last few years, and I've kind of head up the whole department here. We do have broker account executives, we call them, but they're basically a broker manager in our Ohio market. And we'll have a slide later on for the names and the phone numbers and email addresses if you need to get a hold of anybody. But we'll jump right in here. Again, we are Medigold. We have actually been around since 1997 here in Ohio. We are in 39 counties. And we started out basically in the Columbus, Ohio market. Like I said, been around since 1997. We are owned and operated by Mount Carmel Health System here in Columbus. So we've been around for over 23 years now. So we strictly do Medicare Advantage. We have never done anything else. So we consider ourselves really the true experts on Medicare Advantage. Being a startup plan in 1997 and being around for 23 years, I think that really says a lot for our experience. And currently we have roughly, I believe it's around 50,000 members in our service areas. As Christy mentioned earlier, we are also in Idaho and Iowa. And you might think of yourself, well, if you started in Columbus, why are you going to these other states that are out west and in the Midwest? Well, because Mount Carmel Health System, we're owned by them in Columbus, Mount Carmel is actually a smaller organization that's owned by a bigger one called Trinity Health. Trinity Health is a nationwide organization that I believe is in 22 or 23 states and has 93 other health systems like Mount Carmel throughout the country. And they see us as being very profitable here in the Columbus, Ohio market. And we have extended our service area out to different states. So last year was our first endeavor out of state. We went into Idaho. We're in 7 counties in Idaho. And then in 2021, we will be going out to Iowa. We'll be in 8 counties out in Iowa. If anyone is interested in learning about Idaho or Iowa or contracting or certifying with us, please let me know. My contact information will be also at the end of this presentation, and I will be able to get you guys in the touch with the right people. So we'll jump off here. The first slide just kind of explains some little highlight points of our plans. Highly competitive, starting at $0 in the majority of our markets. Service area expansion in Ohio. We're in 6 new counties this year. We expanded one in the southern Ohio, Hocking County, and then also went to 5 additional counties in the Toledo, Ohio market. We also added a second dental buy-up option for all of our plans. And this is a really big bullet point I hit on is we're the highest rated plan by members in Columbus, Dayton, Cincinnati, in the Medicare New Handbook. We really are member-centric. For the longest time, I've been with the company since 2013, and ever since I can remember, we've had a 5-star customer service rating. And that's something we really tout, especially out to the brokers, because that's a lot less hassle for you guys, a lot less service calls that you were getting. And we really put the members first. I remember just being in random meetings throughout the years, and really it's the goal of the meetings to think, hey, what can we do for members? What can we make them the highlight of everything? What can we make it easier for them? Um, a great thing about member services, it's located in Columbus. We don't outsource it anywhere. We have staff in our Columbus, Ohio market. And I actually came from member services back in the day. And whenever you actually had a member issue, you could literally just walk down the hallway and get things solved. It's a really thing we really try to tout, is that we really make our members happy. And it's something that I've never seen before in the industry. Other highlights we have is no copay stacking. I believe only one other carrier here in Ohio participates in no copay stacking. So one copay for each service when you're going to see your doctor. So if you have x-rays or a regular checkup or just a multitude of things in his office, you're going to have that one copay for the visit. Another thing that we're really excited about this year is the senior savings model for all of our plans with the Part D coverage. So if you're not aware of the senior savings model, it's a pilot that Medicare is running this year, where all of the insulins, tier 3 insulins, will have a set copay. Here in the Ohio market, it's going to be a $35 copay for insulin, and that's going for tier 3 insulins, and it's going to be a set copay even in the coverage gap. They will be paying $35 all year for the 30-day supply. Also, we're introducing a member rewards program into our all of our MAPD products this year. So next slide here is going to be Ohio service area. You will see that we're in 39 counties. Like I said, we added Hocking County down there just south of Fairfield, and then we also added 5 more counties in the Toledo market. We added Ottawa, Fulton, Hancock, Wyandotte, and Crawford. So we're definitely expanding. Our biggest mission for Medigold is to grow. That's why you're seeing us entering more counties this year, and you're also seeing us entering new states here in the future. Okay, so we'll jump in right in here for the greater Columbus, Ohio market. You'll see our products, no deductible on medical services, $0 PCP copays, $0 lab copays. The max out of pockets are super low. And you'll see for no additional premium, you'll have the member rewards I talked about earlier, the 24-hour nurse line, virtual clinic visits, preventative dental embedded on all of our plans. All of our plans have silver sneakers, acupuncture, OTC, just transportation. So transportation, we have transportation included on our plans, and that's to and from doctor's offices, the pharmacies, or whatever is easiest, whatever the patient requires. And then also a good thing about it is it's unlimited. A lot of these companies have transportation where you only get 24 uses, and ours is actually unlimited. So that's really nice. We also have something called a visitor travel allowance. And that's something that I will talk about later, but that's a very unique benefit that Medigold has, which allows you to leave the state and visit any original Medicare provider, and we give an allowance for that. Network, we don't require any kind of referrals to see network doctors with Medigold. And then also here in the Columbus, Ohio, we have Mount Carmel Health System, and then we also have Ohio State. We added Ohio State in April of 2020, and that's something we're really excited about and starting to see a real big pickup in our business adding Ohio State, because Ohio State's known nationwide, and here in Ohio market, I'm sure everybody knows about the James Cancer Hospital. A lot of people like to go there for cancer treatments. Going over to the Part D highlights, no RX deductibles on all of our plans, so their copays are going to kick in right away. Our pharmacy network includes 66,000 pharmacies nationwide. This is one big savings for members and your clients would be a $0 90-day supply for tiers 1 and 2 through the mail. So tier 1, if they're taking generic drugs, they're not going to be paying anything for it. So I just want to make everyone aware that how great our pharmacy benefits are. Also, another thing we add to our plans is we have ED drug coverage. That's something we saw a lot of other markets do, not necessarily Ohio, but we do add ED drug coverage for our plans. And here you'll see our product offerings. These are our HMO plans here in the Columbus, Ohio market. We have premiums that range from $0 all the way to $120. Low out-of-pocket maximums on the $0 plan is $4,900. It's super competitive. $0 PCP visit. Specialist is $40. And you'll see if you scroll, kind of put your eyes down the slides here, you'll take a look at, we have OTC benefits on the $0 plan. It's $45 per quarter. You'll see it's embedded with preventative dental, transportation, unlimited trips. Also, we allow a vision hardware for glasses. And then the visitor travel, it's a $2,500 benefit. So I'll kind of get into the visitor travel right now. Like I said, it's a very unique benefit. The visitor travel lets you go out of state, out of network to anyone who accepts original Medicare. Now, the way that works is, let's say you're going to, and you're in Ohio and you're a snowbird, you're down to Florida, and you want to see a specialist. As long as they accept original Medicare, let's say you go see a specialist and the copay for a specialist is $40. Well, what happens is you pay your $40 copay, and let's say the Medicare allowed amount's $100. That leftover $60 comes off of the $2,500. So it's a pretty substantial allowance that we allow people to go see people out of state if they need be, if they're just down vacationing or whatnot. It gives them the freedom to go out of network. And then you'll look at the prescription drugs. Prescription deductible is $0. We don't have any deductibles on any of our pharmacy benefits. And then also you'll see the copays are low. If you go through the retail pharmacy, you'll pay a little more for your tier 1 and tier 2 drugs. But if you get those through the mail, they will be $0. You'll see it's $2 and $5. $45 for preferred brand drugs, $95 for non-preferred brands, and then for specialties it's 33%. I know I hit pretty hard over the essential care plan. The reason I'm doing that is our flagship plan. That's our most popular plan. A lot of, actually all the carriers have a $0 premium plan now, and it's really our flagship plan. It's something we really tout because we think there's great benefit to it. But you'll see that if you scroll your eyes over a little bit, that there are some higher premium plans that offer you a little bit more benefits. Generally speaking, if you go over to the True Advantage and then the Classic Preferred, you'll see the max out-of-pocket drop, the hospital inpatient stay drops. And then another big thing is the incentive items, as far as the OTC goes up, and then also the visitor travel allowance goes up, as well as vision hardware. So there is some benefit to the higher premium plans, in case people want a little bit more protection, a little bit more supplementary benefits. But like I said, our flagship plan really is our essential care HMO plan, which is $0. Okay. So we also have, like I said, we have different service areas throughout Medigold. We're in 39 counties. So we do have, the benefits do change a little bit going through, and you'll see that. The greater Dayton, Ohio market, the copay stay the same, but all the extra benefits we have are still on those plans. Like I said, the member rewards will be on there: visitor travel allowance, transportation, vision hardware, OTC, preventative dental is all embedded there. You'll just see a small difference in some of the copays. In the Dayton area, I'm actually very excited to announce this. We just got Premier Health Network in our system in Dayton. That's something that we're very excited about. It starts 1/1/2021. In the past, we were just Kettering Medical Center in the Dayton area, but now that we have Premier Network, I think it's a big game changer, and you'll see a lot of enrollments for us in the Dayton area this year. Now, highlight some of the benefits. Like I said, you can just kind of scroll your eyes through these benefits. To be honest with you, the Dayton, Ohio market and the Columbus market have the exact same benefits. When we get to the Cincinnati area, you'll see some of the copays go up a little bit or change a little bit for the specialist copay. But for the most part, all the copays are the same for the Dayton, Ohio market as the Columbus market. Okay. So this is our Southern Ohio market. It's It's right below the Columbus, Ohio market that we have. It's in Fayette, Clinton, Highland, Ross, and Pike. The benefits do differ in these counties. You'll see that we don't have a $0 premium plan in these counties. The risk is quite a bit greater in these counties, so you'll see the benefits change a little bit. But it still has the other benefits. I mean, it's silver sneakers, preventative dental, member rewards. Still has, like I said, embedded dental. So there's some still good value to these plans if you live in this service area. So the essential care plan on this in the Southern Ohio, like I said, Clinton, Fayette, Highland, Pike, and Ross, you'll see that the monthly premium for essential care plan is not zero, it is 29. The out-of-pocket max is 5,900. PCP copay is 10. So you'll just kind of scroll through some of these with your eyes and see that the benefits are a little higher on these plans in these counties. Also, I do want to mention something here that I didn't mention earlier. We do offer hearing aids on all of our plans. We use a vendor called True Hearing. And what's nice about our hearing aid plan is that the copays range from $699 to $999 per hearing aid. Now, what's nice about actually having a set copay is you're not given allowance. So you're going to know what you're going to pay for those hearing aids right away. You're not going to go in there, and obviously hearing aids can be quite expensive. Let's say someone gives you a $4,000 allowance. You could get hearing aids that cost $9,000, and all of a sudden you're out quite a bit of money. We have set copays, and our members really appreciate that they know what they're going to be paying for when they go in there. Okay. So here is our Southwest service area, which is mainly the Cincinnati area. Like I said, this almost exactly mirrors the greater Dayton and the Columbus, Ohio market. You'll see a difference in a few copays, but for the most part, it still has all the extra bells and whistles. The network down there, we are affiliated with the Mercy Health System, Christ Hospital, Tri-Health, and now Premier starting 2021. The only health system we do not have in the Cincinnati area is UC, University in Cincinnati. So we do have a very large network down in the Cincinnati area, and it makes us pretty popular with the Medicare eligibles down there. Okay. So you'll scroll through here and just look at the essential care. Still a $0 plan. True Advantage is still $49, and Classic is $120. You'll see that stable in all of our market. Out-of-pocket max is going to be the same on these plans. The specialist copay, you'll see those there. PCP is still zero throughout all those plans. Lab zero. Also, I mean, the over-the-counter is still on these plans. Preventative dental, silver sneakers, transportation, like I said, unlimited trips, vision hardware, and the visitor travel allowance. So great value in all these plans. As you can see, like I said, Cincinnati area, which is going to be Adams, Brown, Butler, Champaign, Claremont, Hamilton counties. Other things to note, and like I said, I haven't mentioned this one either. It's acupuncture. We offer acupuncture on our plans, and I'll talk about this a little more. But you have a $20 copay for six visits, and if you're on the Classic plan, you have 12 visits per year. So this is our Southeast market. So Southeast Ohio market, Perry, Morgan, Noble, Monroe, and Washington counties. If you are familiar with these counties, you'll notice that with other plans, there's also a lot of risk down in these counties, and it's really hard to really offer the same benefits down there. These are the counties that really differ the most out of Medigold. You'll see higher premiums. You'll see higher copays, but the one thing I do want to note is we're still super competitive down there, and we do get quite a bit of enrollment in our Southeast service area. So on the essential care plan, the premium is $39, and on the Classic Preferred, it's $140. The out-of-pocket max is $5,900 for the essential care. PCP copay though, it's still super low at $5. Specialist is right there competitively with the $45 copay. Labs, you'll see that when in the Southeast service area is $10. Still offer the hearing aid benefits. The one thing we don't offer on the essential care plan, this service area, would be the OTC, the visitor travel, the vision hardware. So just a little more risk down in this area, and you won't see the benefits as great. But it's still a great option for these seniors down in the Southeast service area. I do see quite a bit of our brokers write business down there, so it's still very affordable. And I think a lot of it to point out is really our customer service down there. We've been in that service area for quite a bit, and our member retention rates are super high, and people really like to be on Medigold in the Southeast service area. Okay, so the greater Toledo area now. Like I said, we went into 5 more counties. Last year we were Lucas, Seneca, and Wood counties, but this year in 2021 we're going to Ottawa, Fulton, Hancock, Wyandotte, and Crawford. Still have great benefits here. These don't differ much from the Columbus, Ohio market. It's just a different service area, so we have to kind of separate it out. You'll see these in the Toledo market still offer the $0 flagship plan of the essential care. And you also see the True Advantage in Toledo. The one thing you won't see in Toledo is the Classic Preferred plan, but you will see the essential care and the True Advantage in that market. PCP copay differs a little bit here. It's $5 in the Toledo market. Specialist is still low at $35. Inpatient hospital stay, very low at $295 per day, days 1 through 4. And this plan has all the bells and whistles as well with it. You'll see the acupuncture, the hearing aids, the nurse line, OTC, preventive dental is embedded as well. Silver sneakers, it has a transportation with unlimited trips, virtual visits with the PCP or specialist. Vision hardware is allowed, and also visitor travel benefit. So you'll see the plans being still very strong in Toledo market. And also with the pharmacy benefits, tiers 1 and 2, still $0 copay through the mail. Like I said earlier, that's a huge savings for seniors, and especially with the senior savings model. If people are on insulin, I can't express this enough that a $35 copay for a 30-day supply of your insulin on all of our plans. But that's something really to tout, and I think we're going to populate very high on a lot of the electronic tools that people use to enroll. We are part of the Connecture product, so if you guys are using anything with Connecture, they're the ones who built the Medicare.gov website. You'll see that we populate very high on those items, on those resource tools. Medigold also does offer a medical only plan. So it does not have prescription drug coverage, but you'll see that we do offer a medical only plan in all of our counties. We really gear this towards our veterans. We have a lot of veterans in the Columbus market that enroll in this plan. It's a very solid plan. It has all the bells and whistles you'll see in the other plans that we talked about before. But it has low copays, and having that Medicare only plan, they're still able to use their VA benefits. So it's very, very attractive to some people who are retired military. The MA only plan, it has a premium of $55. A lot of people ask you why would they go with the MA only plan without drug coverage that has a $0 premium? You can go in the essential care plan and still use the VA. Well, a lot of people, I point out the inpatient hospital stay. The inpatient hospital stay is $75 per day, days 1 through 7. So a lot of the veterans like the idea of not having to pay a lot of money out of pocket if they do visit the hospital. So that's a lot lower than the essential care plan, which is, I believe, a little over $300 for days 1 through 4. So you'll see a lot of the veterans choose this plan instead of the essential care plan. PCP visit $0. Specialist $30. It's the lowest copay we have for a specialist is $30. Out-of-pocket max is $3,900. Lab $0. You'll see that has the acupuncture with it. Hearing aids are also offered. OTC benefit. Preventative dental is embedded in this plan as well. Silver sneakers is added to it. transportation, virtual visits, vision hardware, and also the highest amount we have for visitor travel, which is $3,500. So you'll see it's a very attractive plan for people who are retired military. Medigold also does offer a PPO in select Ohio counties. You'll see the kind of the counties there. It's Fairfield, Licking, Franklin, Delaware, Madison, Clark, Greene, Montgomery, Butler, Hamilton, Warren, Claremont, and Brown. So it's not entirely in a whole service area, but we do offer a PPO plan. I don't really talk too much about the PPO plan. It's really not the most attractive plan in my opinion. But people who want a PPO option with Medigold, they're definitely we definitely have one. I always try to refer people to the HMO plans because we do have a large network. The Ohio market, we have Ohio State, Mount Carmel, in the Dayton area. You'll see us have Kettering and Premier now here starting 2021, and then Cincinnati area. I mean, we have all the health systems except UC. So it's a very advantageous plan. The HMOs are very advantageous because we have such a large network. But people who want the PPO who do travel to other states, they do like that reassurance. So again, the benefits here, the PPO, it's a $57 premium. Out-of-pocket max for in-network is $5,000. Out-of-network is $10,000 combined. PCP, you'll see is $5 or $15 out-of-network. Specialist, $45 or $60 out-of-network. But this plan does have, doesn't have all the bells and whistles the HMO plans does. You'll see it doesn't have the acupuncture, the OTC, the preventative dental. It does still have the silver sneakers, doesn't have any vision hardware or visitor travel allowance because its PPO plan does allow them to go out of state or out of network if they want. Prescription drugs, this one is the only plan that we have that does have the drug deductible. That starts at $150, and then you'll see the prescription benefits down there: $2 for tier 1, $10 for tier 2, tier 3 $47, and then $100 for tier 4, and then 30% for tier 5. This plan also does not have the ED drugs with it, but it does have tier 1 prescription coverage gap, so the tier 1 copay will stay the same if they do enter the coverage gap throughout the year. Okay, so next I'm going to talk about the formulary and pharmacy information we have with Medigold. This is something we really tout. Our goal is to really populate high in people's portfolio under the pharmacy benefits. We realize that seniors, that's the biggest struggle that they have is the cost of the medications. So I'll go through some slides here and really explain to you guys why it's very advantageous for your clients to join Medigold. So we use CVS Caremark as our PBM. We are on their Part D core formulary, and we might make modifications every year, make super positive modifications. You'll see here we added some generic adherence drugs to the formulary. I am not a pharmacist. I'm not going to try to pronounce these, so excuse me. But we do add quite a few adherence drugs throughout the year and every year on our formulary. We always try to save our members some money. So you'll see every year that we move the drugs down from tier 2 down to tier 1. So you'll see those right there. Like a big one is levothyroxine. That went down from a tier 2 down to a tier 1, which is nice because on those tier 2s, you do have a copay if you visit retail. But if you get all these through the mail, it really wouldn't matter anyway because you get them for a $0 copay through our mail order CVS Caremark. And I do want to point out that our formulary is very expansive. 87% of CVS Caremark's plans have a more restrictive or equivalent coverage to our 2021 formulary. So out of all the clients that CVS Caremark uses, we're one of the top percentile of the formularies they use. So it's very something that's to really tout to our brokers and really beneficial to your clients. Another thing that's really explains how many drugs we have on our formulary. our formula contains 98 out of the top 100 most prescribed drugs for Medicare beneficiaries. So chances are, if your clients are taking medication and they're pretty popular, if they're a popular medication, I mean, we're going to have it on our formulary. So it's something that's really important to highlight is our formulary is very expansive and it's a very solid formulary. So these are some attributes for a formulary. It really explains the commitment we have to our members and the value it really provides them. 91% of all prescriptions dispensed under Medigold are generics. So what that means for your clients is those tier 1 and tier 2 copays are going to be, if they get them through the mail, it's going to cost them $0. So 90% of their drugs that they're going to take are going to be generics, and it's going to cost them $0. So it's something it's huge for our members. 25 out of the top 25 utilized generics are tier 1s on the Medigold formulary. So on our plan, on our HMO plans, you'll see that tier 1 drugs, even through the coverage gap, still have the same copay, has that gap coverage. So because those drugs are utilized, they're tier 1, they're not going to be subject to the coverage gap, and they will still stay at that same set copay for tier 1s. Another thing I really like to highlight is we have no step therapy on our plan. I know from experience, I know someone who's a nurse, and she deals with all the big carriers, and some of the carriers, you know, a doctor prescribes them a medication, might be a tier 4, a non-preferred brand drug, and those carriers make that member go back to the doctor and get prescribed a different medication. They want them to try the generic first, or maybe a preferred brand first. And we do not require that. We trust our doctors. Every doctor we contract with, we talk with and really make sure they understand the value of Medigold, and we trust them. You'll see that if a doctor prescribes a medication, we'll cover it right away. No questions asked, unless it requires a prior authorization, which some medications do. But we don't make them go back to take the generic. If the doctor prescribes it, we'll let them have it right away. So it's something that's really important that we take care of our members. Supplemental drugs, like I mentioned earlier, we do have ED drugs on our formulary. So we have generic sildenafil, vardenafil, and tadalafil are all covered. They're ED drugs. You'll see here that there are some restrictions to it. It's males only, 4 tablets per 30 days across all strengths, and it is available retail and mail. And because it is a supplemental drug, a tier 2 copay will apply for these medications. Also, some other things, you can't get extra help to pay for these drugs. That's something that CMS won't let you do. So you will be, if you do receive extra help, you still have to pay the tier 2 copay for those medications. Okay, so this is something we're really touting this year, is a senior savings model. So for January 1st, 2021, anyone who is on a tier 3 insulin will have the same copay of $35 for a 30-day supply for that insulin, and it's not subject to the coverage gap. So you'll see a few other carriers in the Ohio market do this. I can only think of one that's doing it, but it's going to be super advantageous for members who or your clients who are in insulin, and our plan fits them well because it's going to save them potentially thousands of dollars. It's something we're really excited about. It's on all of our plans, and like I said, it's tier 3 insulins are going to be participating in this, and it's going to be a $35 copay for a 30-day supply. So, like I said, it's something we're really touting this year, and I think it's really going to help brokers sell Medigold to their clients. Our pharmacy network is national. So, I mean, you can basically go to any big chain pharmacy, Costco, CVS, Kroger, Giant Eagle, Walgreens, Walmart. But we also do contract with mom and pop places. I know here in Ohio, I live in the Mount Vernon area, which is about an hour north of Columbus. And we have some mom and pop places in Mount Vernon. I believe it's called Foster's Pharmacy, and they're in network with us. So I mean, it's not just limited to the big chain pharmacies. I know a lot of people still like to go into their pharmacists they've known for years at these little stores, and we do have a lot of those in our network. Okay, member rewards program. A lot of carriers have this. We don't differ from them. You'll see that they have the ability to earn rewards from completing healthy activities, such as doing their yearly PCP checkup or getting a mammogram or colonoscopy, and it will be loaded onto a Visa card. It's going to have the Medigold logo on it. So, yeah, it's something we're really excited about adding this year. It's really going to help our members being able to take care of themselves and also be incentivized for it. They'll get some dollar amounts for participating. Other things we have is the travel allowance, like I mentioned before. I'm pretty sure I went over it pretty well, but like I said, our members get a set amount of money on the $0 essential care plan. It's going to be $2,500, and they're allowed to visit anyone outside of the state who accepts original Medicare. And what happens is they pay their copay, and the rest of the Medicare allowed amount comes off of that $2,500. So, for example, if the specialist copay is $40 and someone has a visit with a specialist in Florida, and the Medicare allowed amount is $200, that rest of the money, the $160, will come off of the $2,500, and that's what they'll have left for that throughout the whole year. So that does get reloaded every year after year, but it's a very unique benefit because it's not limited to a network. It's anyone who accepts original Medicare. Okay, so we'll go over some more supplemental benefits here. Our medical plans are embedded with Preventive Dental. We use Optum as our carrier. We have a large network for dental providers, so you shouldn't see any issues of your clients having problems finding a dental provider being in our network. But the embedded Preventive Dental, you'll see it's pretty normal, just like everyone else has the $0 for twice a year for the exams and cleanings, and it does offer the bite wings and the full mouth X-rays for $0. Okay, so now we also have 2 dental buy-ups. The first one we have is called the Medigold Dental Silver Plan. It's going to be an $18 premium here in Ohio. So you'll kind of walk through these benefits here and see them. So you'll see the exams and cleanings are still $0. X-rays are 0. Minor restorative services, so like pulling teeth, that's going to be a 50% responsibility for the member. Endodontic services will be 50%. Periodontic services 50%, and any kind of oral surgery will also be 50%. So it's a pretty solid plan for $18 per month for looking for members or clients looking for a little bit extra coverage. Okay. And then you'll see the Medigold Dental Gold plan. This one is going to be a $32 monthly premium. The biggest highlight here that I've seen is that on the silver plan, it doesn't cover any kind of restorative services for crowns, bridges, and dentures. This plan does offer coverage for those crowns, bridges, and crowns, bridges, and dentures at 50% coverage. So you'll see here just another buy-up option we have with some extra coverage for our members. And then also if they enroll into the PPO plan, there is a separate plan there. The PPO Dental Silver is a 24-month premium plan, and you'll see the benefits are just the same as the Silver plan. Just the premiums just a little higher. Same thing with the Dental Gold on the PPO plan. Okay, so this is a slide I created myself. It's basically why should brokers contract with us? Why should you be a part of Medigold? And I believe we have a lot of differentiators from other plans. We really do consider ourselves the gold standard of Medicare. Highly rated member services, like I said, we've been 5 stars for a long time. And our member retention rates are very strong, and our member referrals are very impressive. So our members stay with us. And what that really means for brokers is that that's more money in your pocket. The less you have to deal with your clients because our member services take care of them. The retention rates stay the same. We don't really cause any disruption that I can ever think of in our markets. So the members are going to stay with us. We pay lifetime renewals, and they also refer a lot of people. So that's really, it's easy business for brokers, because they're always trying to get referrals, and if their members are referring them to other people to call you guys, it's definitely beneficial for you. Faith-based organization. Medigold is owned by Trinity Health, which is nationwide, like I said earlier, and they are a Catholic organization. So we really try to instill those values with how we treat our members. We've been doing this since 1997. We've been around for 23 years. Another big thing is our members have access to care. We don't require to see referrals to see in-network doctors, and we have very minimal prior authorizations. I know a lot of carriers have prior authorizations for simple things as CT scans. That is something that we do not do. We leave the care in our hands of our physicians. So if we think our physicians are going to prescribe something like a CT scan, we're not going to hold anybody back to get a prior authorization. We'll allow them to have it. Dedicated broker account executives. So we have 2 broker account executives here in the Ohio market, Colin Brown and Michael O'Reilly. They've been in the industry for a long time. They're very solid, very respectable people, and they're local on the ground. So if you need to meet with them, talk to them about anything, they're definitely willing to come meet you. We also, like I said, we pay brokers full market value and lifetime renewals. Our certification process is super quick and easy. We just contracted with IAD this year, and it actually probably within the last 2 months. So we don't have too many of your guys' agents certified yet, but I did send all the information out to the VP of Sales, Dave Huff, and he will be distributing that out to all the brokers. So just look for that to come soon as the certification process. And we also have a full functioning broker portal. It's basically a single point of contact for a medical business. You can enroll your clients on there. You can order materials, view your book of business, see your commission statements. You can also, there's a resource library. There's a lot of things in there. Also, something else I want to point out is we do partner with, like I said earlier, Connecture. We have an online platform to enroll other than our broker portal. And Connecture came out with some pretty cool things this year that are like text to enroll. So you can complete the application for your client, and you send it to them via text, and they just sign it over the phone. It goes right back to you, and now they're enrolled. There's email to enroll. There's personal URLs where you can just send them the URL, and the client can go ahead and fill it out that way. So there's a lot of cool things that Connecture's offering this year. Kind of spoke a little too soon. I guess I had some slides here about the Connecture product. So like I said, it's a digital Medicare. I mean, you can shop, quote, enroll, and retain your customers all on their web-based browser. And also it's on any device as well. You can deliver cost estimates. You can really see how much it's going to cost your members per year. So it's going to rank plans by how much their annual cost is going to be. And because, and I think really what drives the cost up on those amounts is the formulary and also the pharmacy benefits. You'll see that we populate very high on our. I know other FMOs use the Connecture product, and last year we populated the top 2 or 3 every single time. So we're very very reliable and very solid organization for your clients to choose. Most accurate drug costs. A lot of people still use Medicare.gov to look at the medications, but really these tools are the best to look at them because we send files, I believe it's twice a month to Connecture. So those formula files are always updated. CMS only requires Medicare.gov to have the documents, I believe 2 or 3 times a year. So those only aren't always the most up to date, but these Connecture products will always have the most up to date pharmacy benefits. You can also do virtual scope of appointments, send scope of appointments via text or even through email. So it's very handy. Like I said earlier, text to enroll. You can send quotes electronically through your personal URL. And that's what that is there. And then we will be sending communication out to all of our brokers how to access this and tutorials on how to really use the Connecture product. Connecture has come up with a lot of training videos and we do forward those out to all of our agents, so they're all up to date with how to use the product. Enrollment methods, these are kind of a need to know slide, just some highlights I like to put out. We do have online enrollment capabilities, like I said, the Connextra product or on our broker portal. And we still take paper applications. If you want to scan a paper application or fax applications to us, you can send them to that phone number right there, or you can scan them into that email address, medigoldbrokersupport@mchs.com. And really, for any other kind of inquiries, if you have questions, that medigoldbrokersupport@mchs.com is a good email to send things to. Here's some contact information. Like I said, a broker account executive, Colin Brown, Michael O'Reilly. That phone number there for any kind of broker assistance. We have a broker phone number. Member services phone numbers here as well. Our website's easy, medigold.com. You can find, it's one-stop shop for anything. I mean, it's just like all the other carriers' websites. You can find anything you need there. And like I said, we do have a broker portal. If you need access, once you're certified, reach out to the broker account executives and we can definitely get you guys access. Okay, that's it for my presentation today. I know it's information overload, but what's nice is IAD and Christy is recording this video. So if you guys ever need to review it or kind of stop things, definitely reach out to them. But also, if you guys have any questions, please reach out to Colin Brown. He's the broker account executive, and also Michael O'Reilly. Their information's right there. Like I said earlier, they're great resources. Mike used to be a broker back in the day, so he's very familiar. He's been in your guys' shoes. And then Colin Brown, he's been with Medigold, I believe, since 2011. So he's been with us for quite a few years. So very knowledgeable people, and very, very responsive. That's one thing I'd really like to say about Mike and Colin, is very responsive, always answering emails, always taking phone calls. We're really excited to have them in the field. But again, thank you for joining the call today. If you have any questions, please feel free to reach out to Colin or myself or Mike. Thank you so much.
Thank you, Eric. We really appreciate it. We really look forward to this partnership with you. We're excited to have a new carrier partnership with Medigold. So it looks like no questions. And with that being said, again, appreciate your time. And Eric, thanks so much again. And you all have a great day.